So I've been reflecting this morning on two fantastic days that Simon Tucker and I had on Friday and Saturday last week at the ADEX showroom in Egham with a group of dentists from all sorts of backgrounds with all sorts of experiences, and some were practice owners, some were thinking about buying practices, some were just sort of a few years post VT. The workshop is about selling, and I know that's an emotional subject in dentistry. The workshop is called Healthcare or Healthsell, and you might from that get a feel for what our take on selling in dentistry is. And we don't think selling, not as many people see it, has any place in dentistry. I'm talking about the naff manipulative selling techniques that we've all been on the receiving end of, anything from the double glazing salesman through to being upsold at the drive-through in Starbucks. And somehow those behaviours have almost become ingrained, certainly for the people on our workshop. They've started to become ingrained in their behaviours. And yet everybody was saying they were uncomfortable both on the receiving end of that and fundamentally uncomfortable in terms of using those behaviours and techniques, and yet somehow feeling that that's what they've got to do. And yet it was a real privilege to explain and explore that those things are not necessary, and yet you can still have plenty, an adequate and an abundant amount of loyal, motivated patients who proceed with the treatment plans that they want and that you've recommended. And you can do that without pushing, without using these manipulative sales techniques. And I'm talking about things like closing. And there was one young dentist who, when we pointed out that you don't have to close, I don't think they believed us at first. But this idea that the patient cannot leave the surgery without saying yes to you, I mean, it must put everybody, including the patient, under so much pressure. Now, of course, you can ask a question to find out their level of commitment. That would just be common sense. That would be the professional thing to do. But to feel that you've got to close them, and if they say no, then somehow talk them around into saying yes. I mean, just don't even go there. It's naff, it's uncomfortable, and it will get people in a mess if things later go wrong, because it is manipulative. And if the lasting memory that someone has of meeting with you as a patient is they were somehow forced or pushed into doing something, then we are stocking up a problem for the future. Now, of course, you need follow-up systems, and this is why it's a team effort. You need your support team, your reception team, your manager supporting you with following up treatment plans, absolutely. But there is no need to close before the patient leaves a surgery. The other one that came out was this idea that before you've even looked in the mouth, possibly guided by what you know already or sort of information you've gathered from the patient before they've come in to see you, this idea that you've somehow got to almost test the water. It was called the pre-close in the 1980s, and it sounds something like this. I notice you're not totally comfortable with the colour of your teeth, so if I can show you a way to make them whiter, would that be something you're interested in? Well, first of all, what if they say no? Then you feel a bit of a numpty. The second thing is, it feels uncomfortable being asked that because you almost know what's coming next, don't you? You know the sales bit's coming next. This is healthcare, not health sell. There's no place for that in dentistry. The final points I'm just going to make, and there were loads more, of course, which came out of a 2-day workshop. This is a 5-minute video blog. But the final point for now is the idea that if somebody doesn't commit before they leave the surgery, and I'm not just talking about £10,000 treatment plans or massive ortho treatments, I'm talking about an amalgam filling versus a white filling. If they proceed and say yes, wonderful, if they're doing it under their motivations. But if they have some kind of concerns, don't call it an objection. An objection makes it a fight and a battle. We do need to ask questions. They may have a misunderstanding, and it's our job to find out what those misunderstandings are. We've got a whole group of dentists, so going back to their practices this morning, and no, they're not going out intending to sell £20,000 worth of treatment plans in the first week, but they will be in a better position to build patients who are loyal and motivated to proceed with the treatment plans that they want and that you've recommended.